Good afternoon. Thank you so much for joining me today for normal aging versus warning signs of dementia. My name is Lauren. I'm the Educational Services Manager here at Alzheimer's Orange County, and I will be your presenter today. Just a little housekeeping rules. Everybody's muted. Please feel free to come off mute at any time if you have a question that you want to ask, or you could put it into the chat box. I'll keep my eye on that. This presentation is supposed to be interactive and, along with educational fun. So we encourage audience participation. So the reason we talk about normal aging versus warning signs, and particularly for me, is I find nowadays people are tending to fall into two camps. There is my mom is having a really hard time remembering to pay her bills. She's constantly forgetting, but I put her onto auto pay. That's fine. Everything's taken care of. This is just what happens as we get older. It's okay. And then there are the people that say, I lost my keys the other day. I spent the entire day looking for them, and I eventually found them in the fridge, and I'm freaking out, and I'm pretty sure I have Alzheimer's. There just doesn't seem to be any in between. We're moving farther and farther away from that. So we'll go through all of that today. Today, we're going to be talking about what are the normal aging changes that we see, what is dementia, what are the effects of dementia, what are some classic warning signs, and then we'll do some interactive questions. So let's talk about normal aging. As we get older, our brains, like the rest of our bodies, go through changes. So it's normal to process information more slowly or occasionally forget where you left your keys. Perhaps you have more of a tip of the tongue experience than you did before. So again, our brain is getting smaller, less elastic, so we're just going to have these normal changes. So we'll see our memory. It takes us longer to recall information. Our cognitive speed is a little bit slower. It just takes us, someone's talking to you, you say, oh, you know what, can you repeat that? Or can you slow down for me? We have a harder time problem solving. We're still able to problem solve. Again, it's just going to take us a little bit more time, and we maybe not as creative as we used to be. And lastly, we have a harder time paying attention. There's no such thing as multitasking. It's just shifting your attention from one thing to another rapidly. And we find that as we get older, we say, oh, we have a harder time multitasking and a harder time paying attention to multiple things at once. And the most important thing that we can do when taking information in and encoding it into our brain and turning it into a memory is paying attention and deciding that information is worth remembering. And as we get older, that gets harder for us. So that's something that we just always need to be cognizant about, is we need to take that extra time and pay attention. We know as we get older, it's going to naturally be harder. So we just need to focus in on that. So let us move on. So mild cognitive impairment, or MCI, is a very early stage of memory loss. And sometimes people have been using MCI or dementia interchangeably, but they are two completely separate things. Mild cognitive impairment is you're going to have a little bit of memory loss. You might have some difficulty with language or visual spatial perception, so depth perception changes. This is outside of what we expect to see with normal aging, but it's not as severe as dementia. The thing about mild cognitive impairment is that you can continue to live your life and remain independent. So you might have more challenges, you might need a little bit more assistance, but it does not interfere with your daily function. You can continue going on about your day and living independently. Now, mild cognitive impairment, when we think about it, we have our normal aging, and then we take a little step down to mild cognitive impairment. And some people with mild cognitive impairment can continue to live the rest of their lives with no changes. Other people, though, that mild cognitive impairment may turn into a type of dementia. But again, with mild cognitive impairment, we are seeing a little bit of memory loss, maybe more difficulty with language. However, you could still go about your day living independently. You don't need assistance from anybody else. Dementia, on the other hand, this is not normal aging. It's a syndrome. So it's a group of symptoms characterized by decline in memory, reasoning, or other thinking skills severe enough to reduce a person's ability to perform everyday activities. So again, when we talk about dementia, dementia is a group of symptoms. So it's what's causing those symptoms, and we'll talk about that in a little bit. We have both reversible and irreversible types of dementia, which we'll talk about that in a little bit. And overall dementia is progressive, meaning, unfortunately, that it will get worse over time. And as of right now, we do not have a cure. Of the dementias, we'll talk about that. And again, it's a general term for decline in cognitive ability severe enough to interfere with daily living. So how does dementia affect a person? So dementia affects the person's ability to remember. So there's frequent forgetfulness, especially of recent events. So short-term memory is what's affected first when it comes to dementia. So that means that while you still may remember your third grade teacher, or you may remember the college that you went to, you may not be able to remember what you had for breakfast or if you went to the doctor's the day before. We have experienced trouble with cognition, so difficulty with planning, reasoning, and judgment. So this is why when someone has dementia, they may not dress appropriately. It may be 80 degrees outside and they go out and they're wearing a sweater, and you try to say, oh, but it's warm outside. And they just can't comprehend that, no, I don't need a sweater, because their brain's not working that way anymore. It's very difficult for them to understand why someone with dementia may continue driving, knowing that it's not safe. Or turning on a stove and leaving it. Like those problems are very apparent. Language, trouble finding words and losing track of conversations. And word finding, I find, is probably one of the most prominent concerns people have when I talk to them and we're doing memory screens and what brings you in today. I'm having trouble finding words. So again, as we get older, we experience that tip of the tongue sensation very frequently, but usually we're able to recall it at a later time. With this language, with trouble finding words, we're not able to recall it. We're trying to find words and we're saying, that thing, that it's like on my clock, and that word watch is not there, but they're also not able to find a similar word for that. Having a conversation with somebody with dementia, they may be talking and then they just go on a windy path and they lose focus of what they were talking about. And lastly, we see significant changes in behavior. We can see withdrawal. That can be due to depression, or it can be that they're aware of the changes that are going on and they're aware that they're having a hard time following along in conversations, or that their friends are, they're not keeping up. So they choose to withdraw. Certain types of dementias impact the brain in certain areas. So someone with Lewy body might be becoming more aggressive, or we might see more paranoia. So those are all very common, along with classic symptoms like depression and anxiety. So to talk about our reversible and irreversible types of dementia. So again, dementia is a group of symptoms and it's what's causing those symptoms, right? So if you have a fever and body aches, that's not the disease, though something's causing those symptoms. So maybe it's the flu. So with reversible types of dementia, that can be depression, untreated depression. That can be nutritional deficiencies. Iron deficiency and vitamin B12 deficiencies really wreak havoc on cognition. Sometimes thyroid disease. We have either it's untreated, it hasn't been diagnosed, or medication hasn't been adjusted in some time and labs haven't been taken. Infections. Dehydration and infections go hand in hand, and a lot of times we have untreated UTIs. And then lastly, we have drug interactions. And drug interactions We have a lot of different medications that we're on prescribed from a lot of different doctors. And sometimes we don't get those medications checked out. Doctors are prescribing things, not looking at your medication list. Maybe there's a hospital stay and something new is added and something's being forgotten to be taken off. When I was working in memory care, I had a woman come in from the hospital because she wasn't feeling well and her family decided transition to memory care from the hospital was easiest. And looking over her medication, she had been taking blood pressure medication for high blood pressure and blood pressure medication for low blood pressure. So those two medications were interacting and it was really affecting her health. So what I always recommend people to do is if you're taking a lot of medications or you have a lot of doctors, to talk to your pharmacist. This is a service they will do free of charge, but they will look over your medications and they will make sure you're taking the right dosage at the right time. Certain medications need to be taken first thing in the morning before food. Certain medications need to be taken at night because they cause sleepiness. So just making sure that you're on top of your medications. And what's not on this list, but I will be adding, is sleep apnea. We're finding a lot of people are having sleep apnea. It's not being treated. So if you find that you wake up in the morning just as exhausted as when you went to bed, your partner is saying that you snore a lot, talk to your doctor because, again, sleep apnea is a lack of oxygen to the brain and your brain needs the oxygen. So you will feel effects of the cognition on that. Now on to irreversible. And the reason we talk about reversible is because once those issues are treated, you take an antibiotic for an infection, you start taking iron supplements, the symptoms that you were experiencing, the confusion, the difficulty with problem solving, those go away and you return to your baseline. Now with irreversible types of dementia, that's the classic Alzheimer's disease, Lewy body, frontal temporal, vascular, which is caused by strokes, Parkinson's disease, and Huntington's disease. So these are the dementias that are progressive. Unfortunately, there is no cure for these dementias, but there are medications to slow the progression of the disease. And just a little look at statistics. So about 1 in 9 people aged 65 and older will develop some type of dementia. About 2/3 of those are women, most likely due to women living longer, and the greatest risk for developing dementia is age. And Hispanic and African Americans are at a higher risk than their counterparts. And this again is because we experience there are different diseases that Hispanic and African Americans are more at risk for, so diabetes or high blood pressure. And then CTE is chronic traumatic encephalopathy, and that is what football players experience from repeated head trauma. Thank you for asking that. And then so there, yes, Hispanic and African Americans are at higher risk, and also the availability of doctors and those resources. And then by 2050, it's expected about 12.7 million Americans and 152 million people globally will be experiencing some type of dementia. And why do we talk about that is, do we have a system that can support that? Is our insurance, our health support, our family resources, our caregiver resources, are we ready for that? So it's really important that we do everything we can now to lower our risk and prevent dementia. So let's talk about why we're here, normal aging versus warning signs. So we're going to look at some examples and talk through about what's the difference between normal aging and when is it a warning sign for dementia. Now, again, as we get older, we get that occasional forgetting a name. We might forget where we placed something, but we remember it. So when we forget a name, but we remember them later, that's normal aging. When we forget a recently learned information frequently, So we're talking to someone and we know they said their name in the beginning of the conversation. It's gone. It's not there. We're not finding it in our brain, but we know to ask that person. Or when we're thinking down the line, we're triggered and we're like, oh, his name was John. I remember that now. But when we're talking to someone and we're like, oh, can you repeat that? And then we're saying, oh, what did you do over the weekend? And they tell us. And then about 15 minutes later, we say, oh, how was your weekend? What did you do over the weekend? And there's just no recollection that that conversation was previously held. That's a warning sign. And as we talk about these warning signs and what's normal, the biggest indicator that it's normal is that we're able to recall and remember that information later. So if you're constantly forgetting, but you remember that you're forgetting, that's a good sign. So another warning sign, normal aging, of problem solving is normal aging. When we occasionally make mistakes balancing a checkbook. So our math is off. We were doing it and then we look back, we're like, why did I even think that 6 + 4 = 12? We can't figure out what it was that we were thinking in that moment in time. But again, we can recognize that there was an issue and we can fix it. A warning sign is difficulty managing finances consistently. So if we're constantly forgetting to pay a bill, we write the check out, but we forget to put that check in the mail. We're overpaying or underpaying bills. Those are signs for concern. So when we have family members and maybe they're forgetting to pay bills, like my example from the beginning, but the family solution was to put their loved one, all their bills on auto pay. They thought they were solving a problem because their loved one didn't need to worry about the bills anymore. And that's true. It's no longer going to be a problem. It's solved, but we're not looking at what's causing that issue, right? What's causing that person to forget. So moving on to a warning sign of daily tasks. So daily task, a very common one, needing help setting up a new device. We have a lot of technology. Things are changing very quickly, and we need help setting up our new phone. That's normal. We get something new in and it's brand new to us, we'll ask for help. Warning signs is trouble completing familiar tasks, like cooking a meal. So when we have something that we've done all of our life, let's say you know how to make an amazing grilled cheese, that's your signature dish. Then you go to cook it and you can't remember the steps. You can't remember, does the butter go on? Where does the cheese go? How long do I cook it for? Maybe you start cooking it and then you walk away and it gets burnt because you forget that you're cooking it. That's cause for concern. Recently, I was speaking with a woman and she had concerns about her memory. And she was struggling with her remote. She told me, I can't watch television anymore. And I said, oh, what's going on? She goes, I can't figure out the remote. So I have to go down to the lobby to watch television there. So she had a problem. She found a solution for it. I said, okay, what's going on with her remote? And she had 2 remotes and she just didn't know how to use them. And she knew this. Her daughter had spent time talking to her about it. She just could not remember how to use the remote. So that's cause for concern because she's learning new information, but she's forgetting it. And she's also having trouble figuring out a remote, which is typically, they're all very similar in their functions. Some are more complicated than others with all of the buttons. So that was a cause for concern. So another list of, just to go over when there should be cause for concern, is confusing times, places, and events. So when you're not sure what time it is in the day, it's a significant amount, right? You think it might be 4 p.m. in the afternoon, but it's really 7 a.m. You wake up in the middle of the night thinking it's time to get up and go to work. You're not quite sure where you are. You go to the store and you don't know what you're doing there. Maybe you're driving home and you get lost. And you're not sure of major events. So let's say you went to a wedding over the weekend and then you get confused and you say, oh yeah, that weekend was a few months ago. Frequently repeating questions. That's a very common one. And even if you're aware that you may have already asked the question, but you forgot what that information was, that's cause for concern as well. But that constantly repeating questions over and over and over again. Again, getting lost in familiar places. So this will be if you're driving and you don't know where you're going, if it's going to a place that you've always gone to, the bank on the corner, and you start going there and you can't remember how to get back, that driving and getting lost is usually one of the biggest the biggest motivators, I should say, for people to go to the doctor and start having a serious conversation. Even though there might have been other signs long before that, it's the driving that really kicks them into gear. It shouldn't get to that point. So just be very conscious. If you have concerns with your memory and you're still driving, it can happen at a drop of a hat with no warning. So just be very cautious, please. Significant mood and personality changes. So that can be onset of depression, that can be anxious, paranoia. Someone who used to be very introverted all of a sudden is very social, always talking, trying to meet new people. That's cause for concern as well. And then lastly, again, difficulty following conversations or finding words. We're all going to experience that tip of the tongue sensation, but if you can recall that information later, you're good. But if you're having a hard time following along in conversations and getting lost, or you're forgetting the word and then you forget that you were trying to find that word, that's cause for concern. So just to summarize all of that, so what changes as we age? In bullet point form, what's normal aging? Short-term memory declines. Again, it just takes us a little bit more time to pull information out of our brain. Our attention span gets shorter. Overall, we live in a world that's chaotic. It's very busy. We have phones, we have televisions, we have everything happening all at once. And this isn't just something that's happening to older adults. We're seeing it in kids too. Technology is doing a lot for our brain, and it's making our attention span shorter and shorter, especially when we're watching videos and just flipping through video after video. So we need to take that extra time and work on it, and just being very mindful. So for example, when you're talking to somebody, but you're trying to text and you're not listening to the person and you're not remembering you don't even know what you're typing. I've done that before, where I'll be talking to someone and texting. I'm like, I have no idea what I just said to this person, and I don't remember what that person talking to me just said. So it's giving each task your undivided attention and then moving on to the next one. The speed of information processing slows down. So again, it just takes us longer to understand information. Maybe when someone's talking to us and they're giving us directions, and our brain's just not having it. We're like, wait, can you say that again? Wait, so I make a left at the top? Okay, so I make a right. That's normal. Again, multitasking, don't do it. And then, but however, as we age, our vocabulary and our general knowledge increases. So we don't stop learning as we get older. We still have the ability to learn new words, learn new topics, learn new ideas. So that continues to increase. And again, what is cause for concern? When we have immediate recall changes, so we're not able to register information that's coming towards us. Our verbal intellect changes. So maybe someone used to have a wide vocabulary. They were using words like they were an author or a poet. And then they're starting to talk a little bit more in simple terms. Again, having those hard time finding words. So trying to find words that are substitutes, but not quite that correct. A long-term memory decline. So again, short-term memory is affected first. Eventually, long-term memory will be affected as well, but that's down the road. And we're not able to learn new information. So our ability to learn new information slowly decreases. Even people with Alzheimer's and various types of dementia, they can learn new things. They learn new routines, but it gets harder and it takes more time. So let's move on. And again, you can come off mute or you can type your answer into the chat. True or false? It's normal to occasionally forget names and appointments.
Hi,
True.
Lauren. I just want
Hi.
to let you know, Dee had a question in the chat box. Do you want me to read it to you?
Oh, does stress impact normal aging?
Yes.
Yes, I'm going to address that in the end. So I saw that question and I'm going to save it for the end.
Perfect. Thanks.
So, true or false, it is normal to occasionally forget names and appointments. Perfect. Yes, that is true. True or false? Sudden confusion and getting lost in familiar areas are signs of normal aging. True or false? Sudden confusion and getting lost in familiar areas are signs of normal aging. Perfect. False. Everyone will eventually develop Alzheimer's if they live long enough. True or false? Oops, look at that. Okay, false. Oh, some true. Okay, good. This is kind of a trick question. So the correct answer is false. Only about 10% of people over the age of 65 are thought to have Alzheimer's disease. But however, after that age of 85, the risk increases to nearly 50%. And as we know, the greatest risk factor for developing Alzheimer's or other types of dementia is age. So as we get older, our risk gets higher and higher. But just because we get older doesn't mean that we're going to get it. True or false? With normal aging, problem-solving skills may slow down, but they remain largely intact. True or false? Perfect. True. Okay, wonderful. Okay, great. So any questions before we move on to talking about prevention strategies? No? Okay. So when we talk about normal aging, we talk about warning signs. What can we do to prevent or lower our risk of getting dementia? And even for those that may have some type of dementia, we still recommend these 6 pillars of brain health because it is proven to slow the progress of the disease, the progression of the disease, and it's really important for everybody. Someone said exercise. Yes, perfect. So let's go through our 6 pillars of health. So the first one is diet and nutrition. So the Mediterranean diet is the gold standard that focuses on lean protein, a lot of veggies, olive oil for as a good fat, nuts, fruits, whole foods, doesn't necessarily need to be organic, and limiting the amount of sugar and processed foods that someone eats. So focusing on your diet, drinking plenty of water, that's going to have wonderful effects on the body and on your cognition. Exercise and physical health. Does anybody know how much exercise that we should be doing a week?
I'm thinking at least 30 minutes, 3 times a week.
Okay, perfect. Okay, Maple is correct. 150 minutes. So 150 minutes of exercise is what scientists recommend. That could be broken down to 30 minutes 5 times a week. It can be done in what's called exercise snacks. So every hour for 3 minutes, you do exercise, or you find a sport that you love and that's high intensity. So there's a lot of different ways to get exercise in, and you want to find exercise that meets you with where you're at. So sometimes due to a disability, a stroke, heart condition, it could be a myriad of things that we're not able to do what we once were able to, but we need to try to do something. So it's really important that you talk to your doctor before starting any new exercise program. And I think that sounds always kind of silly. Like you're like, oh, I have to talk to my doctor about lifting 2 pound weights, but you do. Because one, your doctor can give you recommendations of exercises that they find are appropriate for you. Two, you can get a referral to physical therapy to learn how to do the exercises appropriately. There's things you could do wrong and you can hurt your body. Um, and three, you might have an underlying condition that you're not familiar with how that affects your body. So for example, congestive heart failure, that makes it really hard to do things. Your body is just walking upstairs is exhausting. So if you used to walk 3 miles and over time your heart disease progressed, you're not able to do that. So you need to find a new way to get that exercise in. Chair yoga is phenomenal. Watching, videos online, all of that. There's resources out there, but you just want to be very conscientious. If you used to do a lot and like the rest of us through COVID, through life, you just stopped being as active. Don't start off where you ended, you finish, start from scratch, start something minor like walking around your block. And also, the things that you do in your house when you do laundry, when you go up and down the stairs, when you're cleaning, those are active minutes for you to consider as exercise. Cognitive activity, that is so important. That's what you're doing here right now. You're learning. Again, as we age, we don't stop learning. Our brain loves learning new information. It loves being challenged. It's what builds the connections, powers off those neurons. So hobbies is a great tool. So who here has hobbies? What are some hobbies that you enjoy doing? And you can type them into the chat box, you can say them out loud. I'll go first. My hobby is reading, golf. Anybody else? Walking, reading, playing tennis, perfect. Pickleball. Ooh, this person's busy. Pickleball, reading, hiking, learning a new language, perfect.
Yeah, mine is reading and painting.
Perfect. So what's really important when we talk about hobbies is that we have our hobbies that we love, but usually when we have a hobby, it's been our hobby forever. And that, while it's good for us, doesn't challenge our brain the way finding a new hobby does. And it can be something adjacent to what you love to do. So if you love to read fiction, trying nonfiction is good. If you love doing puzzles, doing Sudoku or something online can be beneficial as well. If you haven't been gardening, trying gardening, as someone said, learning a new language, learning a new instrument. Someone said playing tennis, which is great because that's both a hobby and it's exercise as well. So challenging yourself to find a new hobby is going to be ideal. Social engagement, that is very, very important. We learn all of these are important. I keep saying each one's more important than the last, but they're all equally important. Social engagement we learned about through COVID. And we learned just how detrimental it was for people to be isolated and not have that engagement. So it's really important that as you get older, you challenge yourself to still stay socially engaged. And I know that as we get older, friends maybe move away or unfortunately pass away, family moves away, and our worlds get smaller and smaller. But it's important that we find new ways to stay engaged. So maybe that's joining a church, maybe that's going to a senior center, going to the library for programming. Um, and it's really important that we push ourselves, even if that means that we do a Zoom meeting with our family or a friend, that we're still writing letters. We just need to keep in touch with one another. Sleep and relaxation. Do you know how long we need to sleep for? How many hours a night does someone in their older age need?
I'm gonna guess 8 to 10 hours.
8 to 10.
I know that's how much I need.
Okay. Yes. Okay. Correct. So the answer is 7 to 9 hours. And does someone in their 80s need the same amount of sleep as someone in their early 20s? Someone said no. Okay, so that's incorrect. So everybody needs 7 to 9 hours. I always love this saying this in a presentation because usually someone always just laughs and says, "Oh no, that getting 7 hours of sleep seems impossible." And I understand that, but it's still needed. So it's really important that if you're not getting 7 to 9 hours of sleep at night, that you're talking to your doctor, because with all of these six pillars, when we don't do it and we don't focus, it's going to affect our cognition. So when we're not socially active or we're not doing our physical health and not prioritizing exercise, we will see it in our cognition. So when we don't get 7 to 9 hours of sleep at night, our brain doesn't get the opportunity to get that good wash that it needs. We're not reconciling all the information we learn throughout the day. So we're not doing those processes that are really important for our brain, and we will see it in our cognition, and we'll see it also in our inability to pay attention. You know how when you sleep, have a poor night's sleep, you're tired, you're groggy, you're grumpy. It's really hard to pay attention. Your brain's just not working at its full capacity. That keeps ongoing and builds up. Same with relaxation, which ties into stress management. Stress management is so important because when we are under constant stress, it causes inflammation, and that is very harmful for our brain and our body. So, stress management is extremely important. And how do you go about that? Every person's different. You need to find a routine that works for you, whether that's at the end of the night, you wind down with a journal. Maybe you do yoga or you practice meditation, you do breathing exercises throughout the day. It's just important to be cognizant of stress and when you're feeling stress, and how you're managing it. Because again, stress, chronic stress can lead to high blood pressure. And if it's bad for your heart, it's bad for your brain. And then lastly, medical health. How about naps? Okay. Uh, Naps are okay, not ideal, and they don't count towards your 7 to 9 hours. That's very important to remember that. But if you take a nap, if you take it earlier in the day, that's okay. But if you take a nap later on in the afternoon, it's going to impact the quality of sleep that you have that night. If you're having too much sleep, that if you find that you're sleeping for 10 hours and you're still waking up exhausted, that means that something else is going on. So that could be, maybe you're at risk for sleep apnea. Maybe there's something going on that you're not fully falling asleep, you're not getting good sleep, or it's an underlying health condition. So if you're finding that you sleep and you're like, I sleep so many hours a night, I go to bed at 8 and I wake up at 8 the next day, but I'm still tired, talk to your doctor about that. Um, Oh, and thank you. Yes, I was going to mention at the end, but I'll talk about it right now too. Lucky put something in the chat. So we do these presentations in collaboration with Anaheim Public Library, and so Lucky, who's at the Canyon Hills branch, they have wonderful programming there. So you can email her. I will include it in my follow-up email if you're looking for programming at the library. That's a great place to go. And then lastly, our medical health. So as we talked about in the beginning, there are reversible causes of dementia. So we're experiencing issues with our cognition, but once we go to the doctor, once it gets treated, we start to feel good again. So staying on top of your medical health, if you have diabetes, if you have any type of heart condition, any type of kidney, that you're aware of it, you're doing your exercises, you're eating well, you're taking your medicine if you're taking medicine. If you have high cholesterol, you're eating, a good, well-balanced diet. Um, you're going to your doctors, you're requesting labs every year just to make sure, there's no infection that's being left untreated. Your thyroid's doing well, you're not iron deficient. But it's really important that we stay on top of our medical health. Again, everything's important. Um, there's a fear of doctors. People do not like to go to the doctor, um, but it's the most important thing we can do is our labs every year, making sure that everything is okay. And if you have any medical concerns, that you're getting it treated right away. Think of it as like your car. If your car is making a funny noise and you think, oh, I can just turn up the volume of my music and I don't have to deal with it, that little tiny problem turns into a huge expensive problem down the line. So Unfortunately, as we talked about, there is no cure for Alzheimer's disease or other types of dementia. There are medications that will slow the progression of the disease. Um, Namenda, Aricept, those are medications that are currently available, and again, they help slow the disease. Someone asked about hearing loss. Yes, hearing loss does put you at a higher risk for developing dementia, in a couple different ways. So one, if you can't hear, you're not taking in an information. So you don't have anything to remember. And then two, those pathways, if you're not using them, they will atrophy and die. So if you are experiencing any type of hearing loss, whether it's subtle or you're just dealing with it, the best thing you can do for yourself is get hearing aids. I know they are expensive, they can be uncomfortable, but it's the best thing you can do for yourself. So please look into that. It's, I keep saying it, it's important. And so just if you have hearing loss, just deal with it. Um, so early, it's wise to get a diagnostic workup as soon as you start to notice symptoms, because again, it could be other causes to those problems. So it doesn't necessarily mean it's dementia, it's Alzheimer's. It could be, well, I'm iron deficient, but you won't know that until you go to the doctor and you get testing done. So when you go to the doctor, you want to start with your primary care physician. From there, your primary care physician can do all the labs, and then they can refer you to a neurologist, and a neurologist can do really in-depth testing. So if you ever really have any concerns about your memory, your doctor's office can offer a memory screening. That's something that my organization, Alzheimer's Orange County, does as well, completely free of charge. It's a quick 20-minute test, and it just says, "Hey, you're within a normal expectation, or maybe you're outside normal expectations." But then you can take that tool to your doctor to start a conversation, or your doctor's office can do it as well. But sometimes you have to go in for the appointment to do the memory screen, and then you have to then go back to discuss the results. So just to save some time. And then from there, you can go to a neurologist to do very extensive testing. That's testing that usually takes a few hours, but it looks at all different areas of the brain. Again, though there's no cure, there's medications to slow the progression, but you need to have a conversation with your doctor to get those medications. So that's really important, and you may be eligible for a clinical trial examining new treatments. Clinical trials are a very touchy subject. Some people are for them, some people are against them. But if you know that you have a diagnosis, you're interested in clinical trials, you're able to move forward. A lot of clinical trials won't, in order to have a conversation, that they need to be able to know that you have a diagnosis, and they'll do testing as well to make sure if you're, the plaques and tangles and things of that nature. Um, what else is early detection allow for? It allows for you to plan for the future, not just you, for your loved ones as well. So if you go into a doctor and you get diagnosed early enough, you can then have a conversation with your family. What are my plans? What are my wishes? What do I want for the rest of my life? Do I want to live at home? Do I want to live in a memory care? Do I want to be on hospice when that time comes, right? How aggressive do I want treatment? Financial and legal matters, establishing power of attorney, establishing trust, all of that legal mumbo jumbo, for lack of a better term, getting that established now, getting those decisions made now, so that when the time comes and you're no longer able to make decisions for yourself, your family's not scrambling. They don't have to, go to court to do conservatorship, but they're able to keep your life moving and keep your bills being paid and keep taking care of you. It allows for you to address potential safety issues. And again, this is for you or a loved one. Is the house safe? Is this person safe living alone? Can they keep living alone for a while? Is their oven safe? Is their house up to code? Is it safe for them to drive? So all of those conversations people tend to have after something happens. Instead, we can gives us the opportunity to have those conversations before something happens. You can learn about living arrangements. Again, everybody's wish is to stay at home. However, sometimes that's just not possible. Maybe it's through the progression of the disease, the behaviors are just someone can't take care of that person 24/7. Maybe someone requires more socialization. Maybe there's, it's not ready for memory care, but there's adult day programs that you can learn about. So it just gives you the opportunity to educate yourself about maybe I don't need this now, but what about the future? What if my loved one falls and breaks a hip? Where are they going to go? What's going to happen to them? So getting to again, having that conversation before anything happens. Developing support networks for both the person living with dementia, the caregiver, the family, finding support within the community, because you're not alone in this disease process. Unfortunately, there's so many others that are going through the same thing and can lend an ear and help offer support. Um, and then again, just preparing yourself for the future. Um, so, okay, two questions just to go back to smell and taste. No, not to my knowledge, that doesn't affect cognition. And then tinnitus, that's a great question. To my knowledge, no. I'm sure more studies have been done on it, but as long as you can still hear, that's the important part. The ringing, though it is unfortunate, doesn't impact cognition. So overall, our key takeaways from today is our normal aging involves slower processing and occasional forgetfulness. So we're going to see changes regardless. It's just that's what happens. Our brain is getting smaller, it's less elastic. We're going to have a harder time recalling information, coming up with solutions to problems. But the key takeaway in that is as long as you were able to remember it later. So if you're having a hard time remembering, but you can remember it later. So to circle back to my first lady that I brought up as an example, who she was worried that she had dementia because she lost her keys, but she spent the day looking for them and found them in the fridge. One, she was able to remember that she lost her keys and she was able to look for them consistently throughout the day. And then two, yes, it's a weird thing to put your keys in the fridge, but as we know, when we're not paying attention, we do silly things. So she was coming in with the groceries, she put those in the fridge, and she just closed the door. She didn't realize that her keys were in her hands when she set them down. So as long as we remember, dementia symptoms are more frequent, severe, and disruptive. So if we have dementia, we're going to see that it impacts our day-to-day life and we can't live independently like we could before, that we start to need more assistance. So our day-to-day life is interrupted. And so again, we're not able to pay our bills. Maybe we forget to eat a meal. We've been skipping meals because we forgot if we ate or not. Food in the fridge has gone moldy and expired, but we don't think to get rid of it, and maybe we eat it because we just don't know better. And early detection and intervention are important in managing dementia. So again, how do we prevent? We focus on the 6 pillars of health, of brain health, and we make those decisions to live better, live healthier. And even if you have dementia, those 6 pillars will help slow the progression of the disease. And we need to not be scared to have the conversation with the doctor, because there's so much we can do. If we get it detected early enough, we can plan for our future, we can have more safety in our lives, we can start medications. But if we don't have that conversation with a doctor, we don't know. So I'm going to end my part here. And now if anybody has any questions, please feel free to come off mute, or you can ask a question in the chat box.
I had a question, couple questions
Yes.
maybe. So I'm with my partner who is old. I think he's like 15 years older than me. He smokes pot a lot. He always has. He obviously doesn't want to stop, but I'm noticing some issues which might be kind of pushing him over the edge of normal aging. But I know when he smokes pot, it makes it worse. So how do I mean, I don't know what to do because I've tried to have a conversation with him before about it and he gets angry. He gets defensive, he
Oh,
gets angry, he doesn't want to address any issues around it. Although at times he will acknowledge like, oh, I have a memory problem, but then
right.
doesn't do
Oh.
anything to kind of work through it.
Yeah, so I think that's very common is either it's a denial of it or if it's such an important part of his day. I don't want to use the word addiction, right? Because I don't know anything about him, but if it's
Yeah.
something he needs to get through his day, of course, that's not something they're going to want to give up.
Right.
I would suggest a third party helping to have that conversation and mediate. Whether that be a doctor, you're more than welcome to call our helpline and we can do a care consultation for you. And just kind of establishing like a doctor can say, okay, like, is there an alternate way, right? Is gummies that are more controlled and a lower dose
Mhm.
effective? Or, you know, they're just coming up with solutions to that problem, but probably having a third person to be the bad guy, so it's not just you, will be
Right.
ideal and say, okay, yeah, you know, yeah, obviously there's something going on. Science is saying, okay, it's going to affect your cognition. It's something that alters the brain. So how can we go about that? And then that way it's not just you nagging, it's someone else coming in from a place of authority.
Okay. All right.
Yeah, but if you we can talk more about that later. But I encourage you to call the helpline too,
Okay.
and they can spend like that time with you to talk about like specific steps.
All right, cool. Thank you.
Lauren, I know you can't diagnose as far as drugs and things are concerned, but my GP has had my wife on domperzol and memantine.
Mm-hmm.
Both of those seem to be helpful. However, her daily behavior still kind of goes up and down. So does that sound like something you've heard before? Or I know new things are coming on the market as far as drugs.
Yes. So, unfortunately, they're not 100% perfect, these medications. And ideally, they're started early, early, early in the disease process to be their most effective. But they will help with, you know, certain aspects. Like, so maybe memory's a little bit better, but we might see changes in behavior. Um, those continue on. But it's normal to have good days and bad days even on that medication, or one area is improved but the others subsequently are not improving. That's very normal. And then yes, this is being recorded. I will send the link out in my email, my follow-up email, to our YouTube page where it'll be available. A couple more questions. Yes, I'll send the slides out via email. Rhonda, if you want to clarify your question, what irritability and shuffling are associated with dementia. Shuffling we see more along the lines of like Parkinson's, but yes, there are issues with gait, and especially because we have depth perception too, it's harder for someone to walk and see in front of them. But I'm not quite sure if that's what you're asking. Anybody else, any questions? So this is our okay. So this is our helpline, 844-373-4400. We are here to help you, and it's not, yes, Alzheimer's Orange County is our name. It's not just about Alzheimer's. We are here for people with the disease. We are here for care partners. We are here for people who are wanting to learn more about brain health or prevention. Whatever it is that you need. If we're not the ones that can provide it, we'll link you up with the appropriate resources. Again, memory screenings are something that we offer. So if you're just curious and want to know what's going on, you can call and we can schedule a memory screening. Yes, to answer the question that just came in, change in personality is a sign. So we can see anxiety, depression. Those are those classic. We see shifts of personality. Maybe someone was introverted, And now they are extremely extroverted and they're always out socializing. Or the reverse, they used to be very social, now they're not. Um, and paranoia in certain types of dementia, we might see paranoia, aggression, hallucinations. Perfect. Anything. And yes, our caregiver, someone commented, caregivers are often overlooked and support is appreciated. This is a thankless job as a caregiver. It requires all of you. It is unlike any other type of caregiving for any other type of disease, right? Caring for someone with cancer is very different than caring for someone with dementia. So we appreciate our caregivers very, very much. Are there any other questions? No? Okay, well, I thank you all for joining me today. It's a lot of information, so if any questions pop up later on in your day, feel free to reach out to me directly via email that will be coming out to you, or you can feel free to call our helpline. And again, I want to thank Anaheim Public Library and Lucky. I don't know if there's anything you want to say, but we are able to provide these wonderful presentations with their support.
Yes, I just want to say thank you to you, Lauren. I love these sessions that we have. And like I said in my chat, if anybody needs any more information about programs at the library, at anyone, I'm at Canyon Hills, but any one of our other branches, I'm here to help. Thank you.
Wonderful. Thank you all and have a great rest of your day.